Many women ask about uterine fibroids. So, what are uterine fibroids? Fibroids are lumps that develop in the womb. Fibroids can grow anywhere in the womb or the uterus in medical terms. They vary in size considerably. Some can be as small as a pea, whereas others can grow to huge sizes like a melon. The most common ones grow in the muscle wall of the uterus. They are called intramural fibroids. Some fibroids develop on the outside wall of the uterus into the pelvis, and they can become very huge. They may put pressure on the surrounding organs. They are called subserosal fibroids. The third type of fibroids is the submucosal fibroids. They develop in the muscle wall beneath the inner lining of the uterus and grow in the middle of the uterus. In some cases, the fibroids are attached to the womb by a narrow stalk of tissue. They are called pedunculated fibroids. Now, how common are the fibroids? They occur in 40 out of every 100 women and develop them in their reproductive years. So they are fairly common. Now, they are seen most often between the ages of 30 to 50 years, but they can be seen in women younger or older. So, what are the causes of fibroids? Why do they grow in the uterus? Now, the exact cause is not known, but they are linked to the female hormone called estrogen. The hormones are actually chemical messengers that the body makes, which helps different parts of the body to talk to each other. For example, estrogen helps to regulate the women's monthly cycles. Uterine fibroids tend to increase in size when estrogen levels are high in the body, such as during pregnancy. They also increase in size with advancing age. But after menopause, when the estrogen levels fall, they tend to shrink or decrease in size. Now, menopause is a time when the monthly periods stop, and this mostly happens after the age of 50. Fibroids are more common in women of African and Caribbean origin, with up to 55 in every 100 women developing them in these population groups. They also occur mostly in heavier women, as they tend to have higher estrogen levels than lighter women. Now, what are the symptoms of uterine fibroids? Symptoms occur in around 1 in 3 women with fibroids. Not all women have symptoms. The most common symptom is heavy periods. 70% of the women with fibroids suffer from heavy menstrual bleeding. Other symptoms include bloating, swelling of the lower tummy, pregnancy problems like miscarriage or premature births, problems getting pregnant. Sometimes pressure on the large intestine can cause constipation. Similarly, pressure on the urinary bladder can cause frequent urination. Pelvic or abdominal pain may be there, or pain during sex, or there might be pain during periods. Many women with fibroids experience no symptoms at all, and they might be discovered incidentally when a woman does an ultrasound for some other reason. Now, having talked about the symptoms, let me tell you how we can diagnose fibroids. When a lady visits a gynecologist, she will ask a series of questions regarding her general health, her menstrual cycles, her pelvic pain, any abdominal pain, any swelling or bloating, any pressure symptoms. After the history, she will do examination. The abdominal examination and the internal vaginal examination. She may request a blood test to check for anemia or low hemoglobin, and finally an ultrasound scan, which will tell us about the fibroids, their location, and their sizes. Now, what should you do if you are suffering from these problems? Many women continue to suffer in silence and never visit a gynecologist for their intimate problems. They may delay seeing a doctor for several years. So it is my recommendation that if you are suffering from such problems, go visit a gynecologist for early diagnosis and better management at an early stage. Fibroids are a very treatable condition. Mostly, women can control their symptoms with medical treatment alone, which means just taking tablets. Although there are many surgical options as well. So better get treatment and don't keep suffering in silence.